Hello and welcome to today's episode. I'm Dr. Lakshmi. There are few noble professions in this world and practicing medicine is one of them. But being a nurse can very well be considered as the noblest in the house of medicine. As nurses are involved in every healthcare procedure, they play a pivotal role in determining the quality, accessibility, and delivering the patient care. Undoubtedly, nurses are the foundation of healthcare and they are considered as the heart and soul of the healthcare system. So today with me, joining, we have Shanti Bhattacharya, who heads the nursing department at Yashoda Hospitals, Somajiguda. Welcome, Shanti.
Hi, everyone.
So Shanti, it's been more than 2 decades in the field of nursing. So could you brief us about your journey?
This is Shanti Bhattacharya, the head of nursing for Somajiguda. Now going to head the high-tech Yashoda Hospital as a nursing leader. My tenure in this journey is more than 20 years. My current journey is with Yashoda, and I'm here today to present few things on nursing.
So we as doctors watch and work closely with you nurses, and the amount of hard work is incredible and unimaginable. So do you think this is a rewarding career?
Of course, I think the nursing profession is one of the noble and the great profession itself, and it is a rewarding career. As you see, a patient rewards when they get discharged, and the smile of thanks which they provide to the nurses is nothing but the emotional rewarding career for the nurses.
So how do you think the perspective of medical field, especially for the nurses, has changed post-COVID era?
I think before the global pandemic era, the nurses' knowledge was very limited. After this global pandemic era, what I could see with the nurses are they worked towards the telehealth nursing in a very larger scale in terms of technology, in video apps, and providing the emotional support to the patients and the families. It was seen in a larger, broader perspective. So yes, I truly admit that yes, nurses have really increased their knowledge post-pandemic era.
So talking about the COVID times, how did you manage the crisis? Because we've seen that most of them were falling sick or quitting the job. So how did you sail through this period?
Yeah, I think this was really a very challengeable situation as well throughout my entire administration career. I have seen nurses initially were not preparing well to look after the patients. They were very scared. The fear and the contacting with the virus, all that was seen, and we saw nurses leaving the hospitals. And but then yes, as a leader and in the hospitals, we have a contingency plan as well. So we had our contingency plan for which we mitigate nursing workforce from different levels, and then we could really achieve the post-pandemic, the COVID perspective well.
So Shanti, I know that you have a very busy schedule. So how do you balance your work life and how do you manage your stress levels for that matter?
I think this is a very tough question, and still I'm, very much greatly I'm able to manage the work-life balances. But yes, when I feel that the stress is dominating me, then I take a little short break. And driving is my passion, so I go for a long drive and I talk to my parents, my families, and that's how I read books and talk to my colleagues. So that's how I get de-stressed and able to perform productively.
I think I completely agree with you that managing stress is one of the key aspects to excel in one's career. So where do you find the support coming from, especially being a busy working woman?
I do receive my support in professional front from none other but from my team. From my team and from my patients, and of course from the management. And in personal front, yeah, of course my family is the backbone, and that's how I'm able to work.
So you must have seen and worked with many nurses with different qualities. So what are the basic qualities you think a nurse should possess?
Nowadays, the nurses who are being hired when we do the hiring process, we see nurses are very knowledgeable enough. They can really compete their skills and competency in their clinical areas, and they pursue their academic nursing education from the very reputed institutions. So I think a nurse should be knowledgeable, very confident, and skill enough to take care of the patients.
So Shanti, I'm sure that this pandemic was the most challenging situation that any healthcare worker would have faced in their careers. So talking about contingency scenarios, basically, how do you manage such situations?
Okay, in terms of managing the contingency scenarios, like we may have mass casualties, we may have outbreak of diseases, and the global pandemic was the live challenges which I think every healthcare industries have faced. So hospital has always a backup plan, especially the nursing department, in terms of managing contingency scenarios. So we always work with the contingency scenarios, and we see the nurses, nursing workforce, and doctors, and everybody else, able to produce a good outcome in terms of patient care and managing those live emergency scenarios.
So working with patients day in and day out and being with them and spending most of the time with them, I'm sure you must be having many memorable experiences. So could you share us about one experience which is very close to your heart?
I would like to share the experience when I was working as a DGM nursing in one of the ex-hospital, and during my evening rounds, it was one of the twin sharing large ward. I could see one patient door was closed, and the patient was from Arabic, Saudi. So I happened to knock the door, and then I could see the attender was very furious, and he was very much scared, and he was not able to speak, and then I couldn't even find any translator behind. Then I asked with my gestures what happened. Then I could see the patient was banging his head very abruptly on the floor, and due to which he got a very bad head injury. So what could I do? I tried to ask the doctor's help, but then in the same time I saw the DMO doctor who didn't know how to suture. So I think it was me. I took all the help from the nurses, and I did the intervention as rapidly, and then that's how I got a lot of rewarding and recognitions from the ex-hospital directors. So I think every nurse, everybody should be very brave enough to take the critical decision making, and so that patient cares and outcomes are very productive enough.
So we as healthcare workers, we go through a lot of burnout and stress levels which are unimaginable. So basically, how do you manage the stress levels as a team?
I know nurses go through these unmanageable stress. So we have something called like a team and fun connect activities, not only in the hospitals, in the hostels. We believe in connecting them indoor, and at the same time we take them outdoor excursions, and nowadays a lot of video call apps where even during the during the COVID, we created a lot of app where nurses could always speak to their parents, with their peer colleagues. Even top management also were involved in giving them a lot of motivation and encouragement. And we always find out what they are good at in terms of their hobbies. So we always try to find those, and a lot of counseling and motivation so that their conflict at workplace are resolved.
So talking about patient care, I think nurses spend most of the time with patients, and undoubtedly they share a special bond with them. So before ending this episode, what message you would like to give to your team of nurses?
The message which I would like to give to the nursing fraternity is, nurses, update yourself, be knowledgeable enough, and empathize the patient scenario so that you can compete in this industry very well.
So thank you, Shanti. It was lovely talking to you and wonderful having you here. And undoubtedly, nurses are the heart and soul of healthcare system. Thank you all for watching us, and do join us for the next week as well. Thank you and take care.